Today I would just like to add a little more to what your knowledge is on breastfeeding, and the intent is to motivate you to continue to breastfeed and also to inspire you to motivate your friends, colleagues, relatives and others to breastfeed as well. As long as possible, continue this knowledge transfer, because this has been possible and you are here only because somebody else has done it, and we are all in this journey together. These are very important points. Breastfeeding is not meant to hurt. It should never. But then you should know when it is hurting so that you can do the correction. So the areola, if you see the structure, the way it is placed, when the baby has only the tip of the nipple and very little of the areola, the pressure is on the nipple. The gland is not in the nipple. The mammary gland and the place where the whole thing starts is a little behind the areola. So imagine this is where the gland is, the milk gland. It comes out as tubules. Once it reaches the areola, just behind the areola, under the surface, there is a muscle. That muscle around this tubule contracts, and with that contraction, milk now comes out. What I mean to say is, if you suck only on the nipple, you are not allowing this muscle to contract at all. So only little milk will come out. And then you remember what I told you about pain? It has a negative influence on the hormone axis. So two reasons why it will hurt. One, because the baby is latching only at the nipple and not having most of the areola inside the mouth, the baby will have sharp suck because it's a very small structure in. So it will cause pain. The pain will inhibit the hormonal axis, milk will stop coming little lesser. Second, even the pressure which should have fallen on the whole of the areola, which is where that muscle I told you is, now there is no pressure at all. Ideally, if the pressure is on that spot underneath which the muscle is there, then that muscle will contract. Instead, the baby, if it is badly attached, will put pressure only on the nipple. So attachment has got 4 factors to it. So the mouth should be wide open, the lower lip should be turned outwards, the chin should touch the breast, and most of the areola should be inside the baby's mouth. So these are the signs of good attachment. So a wide mouth, chin outwards, touching the breast, and most of the areola should be inside. And the reason why it happens, when you do this like with a good attachment, now you are not pressing on the nipple, the pressure is on the areola, and that is where the muscle is, so the secretions and the milk ejection happens.